Okay, here we go. One last time. Gonna go back to our good friend Brenda, binging away with her Netflix, eating her nachos at 4:30 in the morning. Okay, so let's see what we can do to help her out. Okay, so remember she has pain in her neck, her chest, shoulder, and then numbness and tingling in her right hand, skin, discoloration, dropping things, feelings of dull, heaviness, achiness, weakness with her shoulders when she's doing overhead stuff. And she has this lovely posture with the forward shoulders, forward head going on. So, what do we think what's going on with her? I kind of said it. It should be pretty obvious to you at this point that she has TOS. Why is that? What are some of the things that led you to think that she has TOS besides just me saying it? Definitely the chest and the shoulder pain together is curious. I would start to think pec minor. Numbness and tingling, nerve issue going on, blanching. Really kind of seals it for me when she starts talking about overhead stuff, arm weakness causing the blanching, all that. So that would be my suspicion with her, especially since she had no trauma to her neck or her shoulders. So this was obviously occupation induced, kind of a gradual onset over the last 3 months, considering what she does, and how she presents with her posture. I would say she's a pretty good candidate that's what she has, but that's just kind of my thinking. So I would kind of go, okay, so this is what I think. Let's do a test. The tests we would do, the RUSE test, the neural mobility test. Do those. She's positive for those. Okay, I'm starting to think this is where I'm on the right path. I think I've got a TOS that's going on with her. And then what would I do to follow up even further with that? We talked about following your thumbs. I would use my thumbs and palpate. Where would you palpate? Those areas you think she would be sore if she had TOS. The scalenes. Find the scalenes. Go really easy in there. Does that hurt? Her pec minor. Get in there. I'll show you how to get into that one. Palpate in there. Is that sore? Is she kind of tight through her chest area? All that sort of stuff. All kind of comes positive, gives you a clear picture. That's what she has, thoracic outlet syndrome. And then you can just go to your treatment box and kind of pull together a treatment plan on how to help her out. Comes to the next part. This is what you're going to start doing with your case videos, with all these treatment plans. And this is what you're going to be doing on the midterm. You're going to be doing a treatment plan and the final on your cases, your written cases. So how do we do this? This is kind of it in general. I kind of broke it down and gave you like a how-to do it. I'm going to pull this up. This is posted on Canvas. How to do the big for the upper extremity. So this is the example of Brenda with a work dilemma. And it's similar to what you did in context, just a little bit more sophisticated, a little more kind of geared towards upper extremity orthopedic issues. The problem, we're still thinking functional problems. I know in the real world when you go out there, you'll be doing functional goals and purely biomechanical goals. You'll do them over range of motion and strength. I know that's the reality out there, but we want to keep thinking function. We're occupational therapists. That's kind of where our focus needs to be. So think functional deficits related to our shoulder. Really, there were just 2 that we knew about: washing windows overhead and dusting overhead. Our measure. What's our measure going to be? Don't get stuck in that FIM mentality. Measures can be anything. Ideally, something as standardized as possible. In this case, the 2 measures, the big measures you got, usually it's pain. Sometimes you may get FIM scores or strength levels, random muscle test, but usually it's going to be pain. 8 to 10 washing windows, 7 to 10 dusting overhead. So we're connecting there, the pain to the deficit. Here's the new part, the tricky part, the cause. What do you think is causing the problem? So you have a best guess. I had a best guess. She kind of presented as TOS. But I didn't know that for sure. what would you do to follow up? So you kind of, which test would you assume will be positive for her? I would assume that she'll be, if it's really TOS, she'll be positive for the ruse. Her posture was awful. She did have numbness. This all supports just like a bar. You kind of make your guess, and then you have to support it. It's almost like you're in a lab. You're making a hypothesis. I think this is going to happen, or I think this did happen. Why do you think that? Can you support your argument with evidence? This is your evidence. Or even going back to the detective, you think so-and-so committed the crime. Why do you think that? This is my evidence that supports my claim. Ruse test, positive, posture, all these things going on with the posture. The numbness and the blanching, it's a key piece of evidence because it really designates that it's a sensory neural problem. Following your thumbs, palpation of the scalenes and pec minor, but she was sore, as she should be. And here's a key thing too, this insurances love to have this, prior level of function. What was she like 3 months earlier? She had no pain. This has started the last 3 months. So it's not something she's had her whole life. It's something that's kind of come on. You could even put in there occupation involving a lot of overhead motions. And no history of trauma. That's also huge. She has no history of a brachial plexus injury. Just started 3 months ago. She has an occupation where she's doing a lot of overhead. All these things combined, it's like makes this overwhelming argument to your reasoning and to the physician that this is what it is. Because a lot of these shoulders, they'll come in, I think I already said this, but they'll come in these outpatient clinics, and it'll just be shoulder pain, evaluate and treat. It's up to you to figure out what's going on, and then to document that in your eval, send it to the doc, he agrees, that makes sense, this is logical, go for it, you can do your treatment. All right, so that's the cause, your hypothesis, and what do you think it is, and why do you think that, your evidence, and then the intervention. This is where you go right to your treatment box. Just make sure you understand what you're doing, you're not just copying. Doing this because they'll address this problem, doing that because they'll address that problem. You need to know, your reasoning involved. You're going to get really called to the carpet on that. A lot of you when you're doing your clinical, especially if it's a demanding outpatient clinical. All right, so early on, what are you doing early on? Talked about, it's right there, going after that posture, rows and shin tucks, manual therapy and the scalene, sort of calm that down. The pec minor, good pec minor stretch can go a long ways. Get her moving, recumbent bike, stop all activities overhead, sleep, slightly abducted, and then this works. Let's say you're successful, and there's more stuff you can put on here, and when you get to the midterm, I'll expect you to put down as much as you possibly can. No shortcuts, really give me everything you can think of. All this early stuff, let's say it's successful, she calms down, she's feeling better. What are you going to do then? You're going to be, generally speaking, more aggressive with everything, more aggressive with your manual therapies, more aggressive with your stretches, maybe start to get into resistance, that sort of stuff, and have her slowly resume prior activities so she can get back to doing what she wants to be able to do, and this leads you towards your goals. And the goals are, again, similar to context, only you're just adding pain levels, improved pain. Client will wash windows overhead with 2 out of 10 pain in 4 weeks. Client will dust overhead with 2 out of 10 shoulder pain in 4 weeks. The home exercise program, doing that independently in a couple weeks. You could do more goals around there. Are other issues. These are the core ones that I'm going to be looking for. These simple kind of goals. It'll be focusing on function, I think. And that's kind of how to do the big problem for the upper extremity. Again, let me know if you're having issues with this, because you're going to be expected to do this for these case videos and then for the midterm and the final.